Hi, my name is Stephanie Craig. We're from Dearborn County Hospital. I'm the Director of Quality Risk Management here at Dearborn County, and this is?
Thank you. My name is Ricardo Horn. I'm the Director for Discharge Planning, Home Health, and Hospice.
We're here today to talk to you about our readmission or the reduction of readmissions in the CHF patient. We began this project in March of 2010, and with that we had several key components. One, to recognize who was our CHF patient admission, and then obviously try to reduce their readmission. Several components that we began with were to develop an education program and booklet that we could begin using with the patient upon their admission and through their stay, as well as to take home with them. And things that were important to us is to make the booklet have a large amount of pictures, to be written at a 5th grade level, to cover subjects such as how to take your medications, what is congestive heart failure, how to reduce your salt intake, and of course how to weigh yourself and record your weight daily. We also had a clinical instructor that began this process with the patient, reinforced by the staff nurse, and now these booklets are available on the floor and it begins day of admission with the staff nurse. Some other components.
Well, sort of the phase 2 of the program was based on the fact that patients didn't necessarily weigh themselves, or they told us whatever weight they thought we wanted to hear. So we wanted to have something after they left the hospital, another way for Dearborn County Hospital to make sure that the education for the patient continues on. So we developed a home CHF program. What that includes is through our nursing informatics department, we were able to ascertain which patients were identified as CHF, and once that patient was discharged, a printout came to our office. Our office would then follow up. Either they had an order from the physician for home health services, and we would provide intensive home care to that patient, front-loading visits 2 to 3 times a week for 4 to 6 weeks. If the physician did not write for an order for home health, we still followed that patient through the CHF program. We would call them 48 hours to 72 hours after discharge. We would offer an education visit to review discharge instructions. We assess over the phone that they are having symptoms. Then we go ahead and call their physician, fax over a report so that the physician is aware that their patient is having some symptoms, and if the physician can treat those symptoms over the phone or with an office visit, that will also save in the readmission process.